So, so now you remember there is the areas called as a scalp. S is denotes to the skin, C for the connective tissue, A for the aponeurotic tissue, then L for the loose dense connective tissue or the loose aponeurotic tissue, then the P, pericranium. So now let me see, there are the few layers are there, the few layers. Now you can see here, there is a skin connective tissue, there is another tissue known as there are the 5 layers of the tissues are existing on the scalp region. How many layers? There are the 5 layers are existing. One layer to be known as a skin, the second layer to be known as a subcutaneous tissue, the third to be known as a galea aponeurotic tissue, the fourth tissue to be known as a aponeurotic tissue or the subaponeurotic tissue, the fifth to be known as a pericranium. So how many layers? 5 layers of the scalp is there. So we will look into that. So the upper layer, the cutaneous application is different. Then where you need to insert the needle, that's called as a, which place we wanted to insert the needle, which layer we wanted to apply the needle.
First layer. Skin.
First layer. Yes. Very good. So where we wanted to apply the needle, so below the galea aponeurotica tissue. If it goes to the galea aponeurotic tissue, you remember one mnemonics, galea matlab galea deta sune. मतलब इतना दर्द होता है उसको, अरे क्या डॉक्टर इतना दर्द हो रहा है मुझे छोड़ दो, चीखा मारता, बाजू वाले पूरे उठ को चले जाना पेशेंट का नया आदमी आया तो भाग को चले जाता, नको रे बाबा ट्रीटमेंट नको, क्या ऐसा बमड़िया चीखा मार रहे हैं. मतलब गालिया अपोन्यूरोटिक टिश्यू को आपने अप्लाई कर दिया स्काल्प में, उन्हें गालियां दे डालिया, ठीक है. Now remember, see, I recognize it in this way. I am giving you that same information. Where you need to apply sub matlab polite word, subaponeurotic tissue, that's called as a loose tissue. इसका मतलब है कि sandwich tissue. So sandwich needling करके एक needling होता है, तो that to be known as a subaponeurotic tissue. Sandwich अंदर गया तो वो इतना टेस्ट पिघल जाता है अंदर, है ना, isn't it? तो उसे चबाने की जरूरत है, ना, इजी से अंदर चले जाता है. इसका मतलब है सैंडविच नीडलिंग टू बी नोन एज ए सब अपोन्यूरोटिक टिश्यू लेयर टू बी नोन एज ए सैंडविच नीडलिंग. बट स्कैल्प acupuncture always remember that should be needled in the form of the sandwich way, that the patient should not feel much pain. So in that way we want, when we apply to the pericranium, we apply to the galea aponeurotic tissue, that you will going to do the mistake, but you are rupturing to the hair follicles. Hair follicles where it starts the hair, so there you will going to damage, the blood vessels get damaged, where the bleeding also may happen. That's related to the galea aponeurotic tissue. So hopefully we have seen that different types of the layers. Now we look into that quickly, we will proceed, otherwise the time will not permit us to complete the entire portion. Now we are thinking about the standard international nomenclature of the acupuncture we are going to see. In that totally there are the 14 areas has been recognized by the World Health Organization. We will look into that, where exactly those are the 14 areas to treat for the broad spectrum of the disorders. Variety of the disorders, variety of the diseases can be handled for the day-to-day clinical practice. That to be known as a 14 standard scalp lines are located on the scalp. So now we will look into that from where to where these points are located, right? So you understand, I think remember, we'll do it practical as well, but as a theoretical part I'll try to complete. Now we understand the anterior to posterior hairline, anterior to posterior hairline. But there are the two ways. The people will measure from the anterior hairline to the posterior hairline, Also, some of the authors measure from the glabella, the center of the eyebrow, and then the posterior region where the tip of the occipital protuberance they are going to stop. That to be known as a anterior posterior midline. So the entire region we will look into that is the 15 inches and then 12 inches or the 12 shown, or in the form of the centimeter we wanted to see. There are nearly 33 centimeter is existing from the glabella region to the tip of the occipital protuberance. How many centimeter? 33 centimeter, but woman to woman or the men to men or the child, so it get partially differs. But however, as the standard to be known as a 33 centimeter we'll measure as well once we do the practical. Now the another modality to be known as a supercilio-occipital line. Cilio-occipital line, that to be known as a center of the eyebrow. The center of the eyebrow, ear, occipital protuberance. This line, it crosses the ear and then is the posterior region of the scalp region. This entire region to be known as a supercilio-occipital line. Now you remember the key concept is above this is cerebrum, below this cerebellum. Above this bigger brain, then below this cerebellum. I request you who are sitting back, please come front. Some of people come front and then all of you come nearer to me. Because the long distance you are going to miss many things. Please come forward. All of you come forward. From here to here is glabella. This to be known as a cerebellum. Because we try to, whenever see the basic concept, we keep it in the mind. That will be easy for us to implementation for the clinical practice. Thank you. Right. Please come all of you front. But here see, I need your focus and then totally attention so that you will understand. This is something is really very important for the clinical practice. We do get the patients, but we cannot give the appropriate answer to them. But the theory is good, then the practical also good. I used to tell when the car you wanted to drive, the first is he says that my gear dalna. First gear, second gear, third gear, fourth gear, fifth gear tak dal ko gaadi khub chala dalna. You have the intention. So that's not important. What is important? Handling is important. The movement is important. How to balance is important. Then the gear easily you can put. Gear is nothing but is the practical, and maintaining is to be known as a theoretical. But theory should have the hold, then the practical will be easy. Now you just understand. Now there are the 4 lines I am going to cover, but in that 4 lines, anterior oblique line of the vertex of the temporal. Anterior oblique line of the vertex temporal. यहाँ पे 4 lines मौजूद हैं. So to recognize this, I would like to say based on the acupuncture points as well. You keep it the acupuncture points in your mind. That will be super simple for you, right? So one to be known as the center of the midline. The center of the midline. So from the 33 centimeter. So half is to be known as how many centimeter? 16.5 centimeter. You measure like this, right? You measure from here to here. So how many centimeter? 15. Again it is 15. Then perhaps this is as a center of your, you need to initially when you wanted to practice and implement in your clinical practice, don't hesitate to use the scale. Don't hesitate further use for the tape also. Where is tape? Yeah, tape also. Even normally I used to measure with the tape also to the patient. क्या भाई ने टाइलर हो गया है कर को. The patient he feels that doesn't matter, but we need the accuracy. Tailor bhi banna, doctor bhi banna. Nahin. So here we will measure in this way. So now we understand sushenchang, but I will tell you as the names of the acupuncture points. C means is 4, Shen means is front, Chung means is the center. Sushenchang, that to be known as the extra 4 point. Kahan hai so? Extra 4 point. Fortune proximal. Easy way I'll tell you. See, centimeter, it will take for longer time. आपको वो मेजरमेंट पकड़ो. फॉर एग्जाम्पल पीपल यूज एज ए चूनोमीटर. अब ऐसा चूनोमीटर पकड़ के ये फिंगर क्या बांध पड़े नहीं, ये पूरा देख ले को है. पीपल फील इन द बिगिनिंग, बट द क्वालिटी ऑफ अंडरस्टैंड बाय द पेशेंट, बट दैट यू शुड हैव द थियरिटिकल मच होल्ड. Right, then you are doing like a ABCD as a new beginner. They will underjudge you, but you are the learner, you are not the super practitioner. So that's the reason I suggest you, because you all know that acupuncture points, keep it in that mind. That way you just add up sushenchang, that is the fortune proximal to the anterior hairline, and then midline, that to be known as the extra 4 point. C means is the 4, unnumbered, extra 4. Extra 4 means is the 1 point which is located on the top of the vertex. उस point को अगर याद रखते हैं, that to be known as a motor point. That motor point is connecting to the 1 point. That 1 point to be known as a, यहाँ पे आप लोग 3-4 points को याद रखना. हनियान, स्वानलू, स्वानली, चोपिन. हनियान, स्वानलू, स्वानली, चोपिन. क्या सर है सभी ये इंग्लिश के नाम हम बोलो. GB4, GB5, GB6, GB7. So this gallbladder 4 to gallbladder 7 you should register in your mind. वो कहाँ पे हैं हम तो आपको बता दिए, in the temporal gyrus में हैं उस points. तो फिर आपको stomach 8, where is stomach 8 point? Come on quickly. 4.5 chone lateral to the anterior midline, 0.5 chone superior to the anterior hairline. So that to be known as a toe way. Toe means stomach, way means stomach. Toe means is the head, way means is stomach. Which is the point is located? Stomach 8, you remember in your mind. Where is stomach 8? 4.5 chone lateral. From here is the point is located. From there, you just draw the line to the gallbladder 7, that is Chu pin. Gallbladder 7. Where is gallbladder 7? This is gallbladder 7. इसको फ्लिप कर लो. ये ईयर को आप सामने के हिस्से में फोल्ड कर लो. जब आपको ऊपर का हिस्सा टच होता है, anterior part of the ear, this to be known as a Chu pin. Gallbladder 7. Gallbladder 7. उसको एक लाइन ड्रॉ कर दो. That entire line to be known as a, this the motor function, sensory function, tremor function, the blood pressure function. आपको 4 लाइंस ठिकाने में दिमाग में बिठाना है. बिठाएंगे आप लोग? सर आप बोल को दिए तो ढंग से हमें बिठा लेते. प्रैक्टिकल भी बोलना आपको नहीं. So let me see. One is extra 4 to GB6. Extra 4 to GB6 to be known as a motor function. Motor function मतलब क्या क्या प्रॉब्लम को ट्रीट कर सकते हैं? हेमिप्लीजिया, पैराप्लीजिया. इसका अलग अलग क्या है? हेमिप्लीजिया मीन्स one side of the paralysis, right? Monoplegia, one part of the paralysis. Upper limb मतलब एक हाथ या one leg paralysis is called as a monoplegia. Diplegia, this is 2 hands get paralysis, that's called as a diplegia. This both the legs got paralysis, that's called as a paraplegia. Both the legs is paraplegia. Then quadriplegia or the tetraplegia, both are same. That upper limbs, then lower limbs got paralysis, that to be known as a quadriplegia or the tetraplegia. Matlab upper limbs also not functioning, lower limbs also not functioning. He is lying down, the brain is dead, They're like a dead man, but however he have the breathing and everything, but the movement is not there. But the coma is different. The dead brain is different, but he have the consciousness. He can talk everything, but the movements is not happening. So this is called as a tetraplegia. In this condition, the pai hui and then is the chu pin. Pai hui and then chu pin. DO20 to the, you can look at about image also. DO20 to the gallbladder 7, that to be known as a somatosensory cortex area. Sensory cortex area. तो उसका मतलब क्या है? All the pain related conditions can be treatable by using that particular line. So now we understand 1.5 centimeter, that means half chone above, 0.6 chone, 0.6 chone. Otherwise you keep it, take the scale and then measure it. 1 centimeter is equivalent to the, you understand your pinky finger. In that you look about the corner of the nail, right side and left side corner of the nail, you measure the corner of the nail, both the sides, what is the size is it? That to be known as a 1 centimeter. 1 centimeter. Right. 2.5 centimeter is equivalent to the 1 chone. So hopefully we understand this. Right. So now 1.5 centimeter anterior to the motor area, that to be known as a Tremor area. Tremor area. So that name itself, it gives the information that can be treatable for the various type of the tremors, the tongue tremors, head tremors, neck tremors, hand tremors, wrist tremors, finger tremors, leg tremor, toes tremors. All are connected to the tremor area. I would like to tell you from where to where we need to target, and then we do the treatment for the various types of the tremors.
Sir,
now come to the...
Sir, excuse me, can you repeat once more the tremor area?
From the upper part to the lower part, now divided into how many segments? 5 segments. The entire line is divided into 5 different parts. Upper 1/5 part to be treatable. Now you remember how to understand the auriculotherapy. The head is down, the upper limbs are upside down. Right? The little man is existing on where? Where the ear is there, ear to be known as a head region, top to be known as a lower region. This is as a lower extremities and this to be known as the upper extremities. That means the head and neck region, and this is as the upper limbs and this is as the lower limbs. Remember, ulta insan soya hua hai. Opposite way, the down, upside down. How the sarvangasana is there. So sar is the head is down, legs are up. Likewise, the homunculus is existing on this region. Based on that perspective, if you understand, it easily you can capture in your mind. Now, the upper 1/5 portion, upper 1/5 portion, this much portion to be known as a lower limbs. Upper portion. Here is the upper 1/5 treatable for the lower limbs. When the leg tremors are there, or some kind of the leg, any problem is there, so that time you can treat for the leg tremors on the upper 1/5. When the hand tremors are there, so that time you can use the, so upper is 1/5, lower 2/3, 2 and then 3/5, that entire area to be covered for the hand tremors. Then the lower portion of the lower 2/5 area to be known as a head and neck tremors, the tongue tremors can be treatable on the lower portion of this area. So now let me draw here to understand. 5 areas can be divided into all the segments. upper 1/5 to be known as a upper 1/5 to be known as a yes, lower extremities. जितना भी पेन रिलेटेड फॉर एग्जांपल DU20 से लेकर DU20 वन चून डिस्टल कैन बी ट्रीटेबल फॉर द लोअर लिम्स. Lower back pain, knee pain, ankle pain, swelling can be treatable from DU20 to downwards direction. Same is this region to be known as a motar area. Upper 1/5 treatable for the leg numbness or the leg paralysis can be treatable on the lower portion. I think we require the practical orientation, I'll tell you. But this region to be known as a tremor area and this area to be known as a vasomotor area or the vasoconstriction area. Vaso means is blood vessels. Anything the blood related conditions, arteries or the veins or the arterioles or the venous system related problem can be treatable by activating this system. So we will look into that practical as well. So hopefully you can have a look here also. There is a image how we can treat by using the 4 motor points. So exactly related to the various conditions. Now upper limbs and lower limbs paralysis and also related to the pain related conditions, tremors and hypertension, varicose veins, and also there is a swelling, pedal edema, ankle edema, that all can be treatable by activating. These are the 4 lines can be successfully treatable.
Sir, 1 chun is the distance between the every lines, na sir?
1 chun anterior to each, you mean to say?
Yes, sir.
No, Puneet, but not all the time. Not all the time. Maybe approximately I can say you measure 1.5 centimeter would be better in normally. So it gets slightly differs. 0.6 to 0.7 chun, but approximately maximum 1 chun, but not all the things are 1.5 centimeter anterior to that each line to be known as a one area is there. But however the larger area of the head is there, so that time it is equivalent to the 1 chun also you can measure in order to understand for the each line. So hopefully we have seen that posterior oblique line of the vertex, then the anterior temporal line. So now you just keep it in the mind. Some of the points is very important here. So now anterior temporal line. So there is a points, you remember Hanyan, Swan Lee. Hanyan is GB4, Swan Lee is the GB6. So midway between these 2 lines are able to treat related to the head and face and neck region, including the migraine, motor aphasia, facial paralysis and oral cavity diseases. Now you just keep it in the mind. Number 1 to be known as a GB4 to GB6. There are the one needle connecting to through needle, treatable for what condition? Aphasia. That means the fascia, apraxia, pyrexia, all are connected to the speech related disorders, and further the head and neck related problem, what we call as a facial paralysis, Bell's palsy and neurogenic pain, trigeminal neuralgia. So connecting to the sensory and then motor mixed related problem of the head and neck and face region can be treatable by activating the single point, that to be known as a GB4 to 6. GB4, GB5, GB6. 3 points collectively using the single needle, that to be known as a through needle, so that to be activated. Now the posterior temporal line. So posterior temporal line to be known as the Chubin and then Shuaigu. Where is the gallbladder 7 and then the gallbladder 8? Where is the gallbladder 8 point is located? 1.5 chun. not the centimeter. 1.5 tune proximal to the apex of the ear in the temporal region. So this is as a shuaigu. Shuaigu is gallbladder 8. Tube in the anterior part of the ear, that to be known as a tube in. So connect together. Shuaigu and then tube in. Connect together gallbladder 7, gallbladder 8. Connect together, that to be known as a posterior temporal line, can be treatable for all the ear related disorders, deafness related condition, the partially deafness, or the mild to moderate hearing loss. But 100% hearing loss cannot be treatable by using this point, because I couldn't see any more results over there. But partially the person will come, the Deve Gowda ji is coming, honorable former Prime Minister will come, hey, kivi kelsadilla enana maadu, or kenana madakagutta. Voice related problem, age related disorders, isn't it? So that means the cochlear now, vestibulocochlear now got damaged, that causing the problem, that cannot do it much. But less than 60 years, less than 65, 70 years, we wanted to do something, then definitely we can treat by activating the one line, that to be known as a posterior temporal line, that connecting to the gallbladder 7 to gallbladder 8, connect through to through needling, can be treatable to treat for the tinnitus. One word is coming to my mind. Tinnitus is not super simple to treat, but however there is another supercilio point, you keep it in the mind, that point to be known as a French GB20 point, to treat for the tinnitus as well. To treat for the tinnitus as well. However, by the way, you wanted to use the complementary point to treat for the tinnitus, Feng Fu, and then is the Na Hu. Feng Fu, Na Hu, Feng Chi, and then Shuaigu, Chubin. These are the collectively points treatable for the tinnitus. Maybe some people think that Chinese names are important to write in the examination, but however I am also telling the pin in names, register in your mind also. But some of the people who are new into this, but don't think, take it to your mind that Chinese names are not important to you all, right? मैं बोलते बोलते तुम्हें भी सीख जाती नहीं, उसे मैं बकतूं सो, ठीक है? You should keep it in your mind always, right? So number 1 to be known as the tinnitus problem, treatable by using the brain point DU16 and then DU17 area, GB20 area, gallbladder GB7 and then GB8. All the points collectively treatable for what condition? Tinnitus as well. So hopefully all the ear related problem can be treated.